and welcome to the Johns Hopkins 30-minute COVID-19 briefing, where we provide live insights from the experts who lead our work at the Johns Hopkins Coronavirus Resource Center. For the next half hour, we'll focus on what you need to know right now about the COVID-19 pandemic and public health responses. As part of this briefing, we'll have an opportunity for live Q&A with our experts, and we'll be offering these 30-minute briefings regularly on Fridays at 12 p.m. I'm Dr. Lainie Rutkow, a professor at the Johns Hopkins Bloomberg School of Public Health, and I'm part of the leadership team for the Johns Hopkins Coronavirus Resource Center. We'll be providing answers in real time today, so please submit your questions in the box at the bottom of your screen. As always, there's much to discuss with our experts. Today, I'm joined by two guests. Dr. Brian Garibaldi is the medical director of the Johns Hopkins Biocontainment Unit and an associate professor at the Johns Hopkins School of Medicine. Brian will give us an update about the treatment of COVID-19 patients. I'm also joined by Dr. Bill Moss, who's the executive director of the Johns Hopkins International Vaccine Access Center and a professor at the Johns Hopkins Bloomberg School of Public Health. Bill will give us an update about COVID-19 vaccines. I'll now turn to each of our speakers for a brief overview. Brian, you've been a frontline provider since the very beginning of the COVID-19 pandemic. Can you help us to sort through some of what we've been hearing this week in terms of masking or even double masking, as well as these more easily spread variants?
Thanks, Lainie. So I thought we would do a little bit of a show and tell today to really get into the meat of the mask issue. So as many people have heard about, we've been talking about not only wearing masks and the importance of wearing masks, but also making sure that you have a mask that fits very, very well. And that's where this idea of double masking or looping your mask comes in. So I have here just a regular surgical mask. And so you can see if I put this on here like this and try to pinch it around my nose, it fits okay, but there's clearly lots of gaps here. And if I take a breath in, you really don't see the mask move at all. So there really isn't a tight seal with that mask. So what you can do with these masks is you can fold them in half like this. And then you can tie the ear loops in a knot around your finger. And I happen to have a pre-prepared one here, so I don't have to tie the whole thing. You get the knot really, really close to the edge of the mask. And then you can tuck in these extra sides here. And when you put this mask on, you fit it over your face and get your ear loops on. You can now see that this has a much tighter seal around my face. There aren't these gaps here. And when I take a breath in, you can actually see the mask moving as I take a breath in, which means that there's a pretty good seal there. The other thing that you could do is you could wear your regular cloth mask, make sure it's up over your nose, or excuse me, regular surgical mask, and then have a tight fitting cloth mask that goes over that. And this really accomplishes the same thing. It creates a very, very tight seal. And you can see when I take a breath in that I'm moving the mask, which means there's no air coming in from the side. And so there was work that was done by the CDC and other groups that have shown that if you wear just a single surgical mask and you put it on your face and you cough, that blocks about 40% of the particles that come out. But if you either use the loop tie or a double mask with a cloth mask over a surgical mask, you block a much higher percentage of those particles. But they've even shown that, they've done these really great experiments where there'll be a head that can cough particles about the size of the droplets that we think spread coronavirus, and then another head that can detect those particles in a sealed room. And they've shown that if you put the mask over just the person who's coughing, you protect a little bit the person who is in the room with you. But if both of them are wearing the mask, particularly if they're wearing either the loop fitted mask or the double mask, you can block about 90 to 95% of those particles from getting to that receiver. So I think what this research really shows is that everybody needs to wear a mask when we're indoors. And once we get to the point where now most people hopefully are wearing masks, if you double those masks or have a tight fitting, well-sealed mask, you're going to be much more protected, particularly if you're in an enclosed space. The other thing that's important to remember that many people are trying to get themselves either N95 masks or KN95 masks, which are the masks that we actually use in the hospital. This is one of the masks that I wear in the hospital. But you have to be careful where you get these and make sure that they actually have a NIOSH approval on them. because there are some counterfeit masks that are out there that are not going to give you the same protection as a real medical mask. So I think the important thing to remember is that you got to be wearing masks. And if everybody's wearing a mask, that's better than if just you're wearing a mask. And the reason this is important is we've heard about these variants that are now spreading throughout the world and have been detected here in the United States. There's one from the UK that we've heard a lot about. There's one from Brazil. There's one from South Africa. There's one that's been described out in California. And we're still learning about what these variants mean, but for some of them, there's emerging evidence that they can spread more easily. And so wearing a mask that's tight fitted or even double masking is going to protect you and those around you from these variants that can probably spread more easily, particularly during the winter when we're indoors. And I think it's really important to keep that in mind. You know, we're now seeing for the first time in many, many months, we're starting to see cases go down. We're starting to see hospitalizations go down across the country, and we're finally starting to hopefully see deaths go down. But we could take a step backward if these variants are continuing to spread, and if people aren't really making sure that they're protecting themselves and those around them, we could see a resurgence in the virus. So I think this is an important reminder that you got to wear a mask, but you also want to make sure that you're wearing a mask that fits well. And if you're wearing cloth masks, we know that multiple layers is better than a single layer. And if you're going to wear a surgical mask, doing the loop tie probably increases its efficacy. And wearing either there's some mask fitters you could wear, or putting that cloth mask on top of it is going to probably protect you and those around you a little bit better. And I think the improvements in what we've seen around the country are real. I was on service in one of our COVID ICUs last week, and for the first time in many months, we actually switched from being an all COVID ICU to being an ICU that could take care of non-COVID patients. So I think we're seeing real gains, but it's important that we continue to be vigilant and prevent a resurgence from some of these variants while we're waiting for the majority of us to get vaccinated.
Thanks so much, Brian, both for the mask demo and for giving us a little bit of a bright spot in the midst of all that's going on. Before I turn to Bill, I want to remind our audience, please submit questions for our experts, for Brian or for Bill, in the box at the bottom of your screen. Bill, in the last week, we've heard some concerns about the AstraZeneca vaccine and the variants, and there's also hope in the US for additional emergency use authorizations. Can you talk us through the latest vaccine news?
Yes, thank you, Lainie. And another busy week in the vaccine world. I will start off with a good news story. On Monday, Facebook announced that it was taking more aggressive steps to combat conspiracy theories and misinformation about vaccines. They had begun to do this, but now expanded their list of false claims that they will not permit on their sites. And these include claims that the COVID-19 or the SARS coronavirus is man-made, that vaccines are not effective against the diseases they are meant to prevent, that vaccines cause autism, and that it's safer to get COVID-19 than receive the vaccine. So this is a big step for Facebook, a big step for us. I think even a big step for the enlightenment and science, that these social media platforms are taking more aggressive stances, not just in the political arena, but around misinformation and disinformation on COVID-19 vaccines and vaccines in general. And later in the week, Robert F. Kennedy Jr. was barred from Instagram over false vaccine claims. So this is a promising this is progress in social media. I'm going to use my simple framework of the 4Ds and just give a brief update on where we are. The 4Ds are doses, delivery, demand, and data. These are the 4Ds that I consider really critical for a mass vaccination campaign. So here in the United States, we've administered more than 68 million doses have been distributed, more than 46 million doses administered. That's up to 68%. So we've seen a steady increase in that proportion. More than 11 million people have received 2 doses. And so at least 10% of the U.S. population have received 1 dose. So we continue to make slow but steady progress in vaccinating the U.S. population. We have, in terms of doses, some news this week. Just yesterday, the Biden administration announced that they've purchased an additional 200 million mRNA vaccine doses, 100 million of Pfizer, 100 million of Moderna. This brings to a total of 600 million doses of these vaccines that the US government has purchased. So that's enough to vaccinate 300 million people. So most of the people in the United States. So we now kind of have those doses ordered. The big problem is getting them into people. As you said, we are expecting that there could be an emergency use authorization issued by the Food and Drug Administration for the Johnson & Johnson vaccine. This is an adenovirus vectored vaccine. Has some advantages, can be used as a single dose. We saw 72% efficacy in the United States, not as high as with the mRNA vaccines though. But another big advantage of the J&J vaccine is that it can be refrigerated, doesn't require that ultra cold temperatures. We're expecting the advisory committee to the FDA, the Vaccine and Related Biological Products Advisory Committee, to meet on February 26th. And if everything goes well and the data look good, that we will see an emergency use authorization soon after that. Still in the pipeline here in the United States are the AstraZeneca vaccine, which is another adenovirus vectored vaccine, and the Novavax vaccine, which is a protein-based vaccine. These both of these vaccine platforms are in phase 3 trials. Possible we'll have an emergency use authorization for these vaccines in the coming months. And so that'll give us a larger portfolio of vaccines and increased numbers of doses. On the delivery side, again, we continue to make slow but steady progress. Some big news. The U.S. Yesterday started shipping doses of of our mRNA vaccines directly to retail pharmacies, and so today these pharmacies should have the doses to begin administering to people. It was an initial shipment of 1 million doses, so not a huge amount, but now getting kind of a direct pipeline from the U.S. government to these retail pharmacies to be able to reach a wider audience. The FEMA also will be using 1,000 active duty troops at COVID-19 vaccination centers. So we're seeing increased mobilization of the workforce to assist with getting vaccines delivered into the arms of people. On the demand side, there was a study this week from the CDC on vaccination intent of people who were in the kind of top priority groups for COVID-19 vaccination: healthcare workers, residents and staff of long-term care facilities. Some promising news, but still some concern. From September to December, they report that the proportion of individuals in these high-risk groups who intended to get vaccinated increased from 39% to 49%, and the non-intent decreased from 38% to 32%. So still a fair amount of work needs to be done on the demand side and building trust with vaccines. And then lastly, of the 4 Ds, the data. Last week, we talked about some of the problems we have in understanding who's actually getting the vaccines. And there was that initial report we discussed where half of the people who were vaccinated in the first month of the rollout, we didn't have basic race and ethnicity data. So we need to do better on the data side. Lainie, you and I talk about this all the time with the Johns Hopkins Coronavirus Resource Center website and the real need for data. Today, I want to just emphasize the real need for data on vaccine safety, and particularly vaccine adverse events as we roll out and more people get these vaccines. There is a long-standing system. It's a passive reporting system in the United States called the Vaccine Adverse Event Reporting System, or VAERS. That is in place. The CDC did initiate a newer program, again, passive reporting, called vSafe, where people can report any adverse events on their smartphone after receiving the vaccine, but we still need better data on adverse events after vaccination as we vaccinate millions and millions of people. And there was a system that has been developed a couple of years ago and was supposed to be rolled out called the BEST system, or Biologics Evaluation Safe Initiative. That's still having trouble getting rolled out. That's more of an active surveillance system. So on the data side, we still need to do better in both in understanding who's getting vaccinated and recording adverse events. I'll just finish up on the variants. You mentioned that, Lainie. The big news this past week is that South Africa halted plans for a rollout of 1 million doses of the AstraZeneca vaccine, again, an adenovirus-based vaccine, because they were seeing quite low vaccine efficacy for mild and moderate disease in their country. Most of the cases, they're occurring in younger individuals, so they're not seeing the severe disease. They were not able to say definitively whether or not the vaccine was protecting against severe disease. We do know from trials of both the J&J vaccine and the Novavax vaccine that were actually done in South Africa that those vaccines still had relatively high protective efficacy against severe disease. We're going to need to see if that plays out with the AstraZeneca vaccine as well. But it is of concern that we're seeing lower vaccine efficacy, at least against mild and moderate disease, against that variant that was first identified in South Africa called B.1.351. Thanks, Lainie.
Thanks so much, Bill. I have come to look forward to your Friday feel-good vaccine stories. Now we're going to move over to Q&A. Lots of questions coming in for both of you, as always. Bill, first question is for you. Once someone is fully vaccinated, meaning they've received 2 doses of Pfizer or Moderna, why is masking still recommended?
Yes, it's still important, despite individual having received 2 doses of the vaccine, that they continue to practice good public health measures, and that includes masking for the reasons that Brian outlined, as well as physical distancing and avoiding large gatherings. The reason is that one, the vaccine are not 100% effective. People can still get infected and still get mild disease. And although we're still learning about how much these vaccines prevent transmission, they almost certainly don't completely protect or prevent transmission. And we know that just because some individuals are getting mild disease. So I would say, as long as we have very high levels of community transmission that we still have in the United States, people should be masking even if they've received 2 doses. Now, the big news this week was that the CDC did issue guidance on quarantine in those individuals who've received 2 doses of the vaccine, and it's been at least 2 weeks after that second dose. That's how long it takes for the immune response to develop. Those individuals do not have to quarantine as long as they remain asymptomatic. So we're beginning to see some relaxation of some of the stricter public health measures in individuals who've received 2 doses. But as long as community transmission is still high, even those who receive 2 doses need to mask.
Thanks, Bill. And we're getting a few questions related to pods or bubbles. So Brian, I'm going to start this question with you, and then Bill, ask you to weigh in on the vaccine angle. So Brian, the general question is, how can people be safe right now if they're within a pod or a bubble? We see that numbers are declining. Soon the weather's going to warm up. What's your advice?
Well, I still think it's important to remember that, the virus is still, there's still a lot of virus out there, right? So even though we've had encouraging news in terms of numbers of new infections and numbers of hospitalizations and death, we're still leading the world in terms of numbers of infections. And so, the highest risk activities are gatherings, particularly large gatherings indoors. And you just have to, think about what your risk is, think about who's in your bubble. I'm just thinking from my own personal experience, I've been vaccinated, but my wife and children have not, and most of my friends have not been. And so we have still, maintained we do not hang out inside, even with our close friends. You have to try to figure out what your individual risk might be, who's in your bubble, who's potentially at risk for severe disease from COVID, and try to make those individual decisions. If you are going to be spending time inside, I think heeding the advice I was talking about earlier about making sure that you have a tight fitting mask or even double masking is going to decrease your risk of being exposed to the virus. It's not going to make it 0, but it's going to decrease it. I think the types of activities that you're doing are also important, right? So if you're gathering indoors and then you're taking off your mask to eat and drink, it doesn't matter if you have a great tight-fitting double mask or even an N95 respirator. If you're taking it off, it's no longer going to be protecting you. So I think you have to be mindful of who's there, what the activity is, and try to minimize those exposures the best that you can.
Thanks, Brian. And Bill, I want to ask you to answer a similar question, but with the overlay of vaccination. So for folks that are in pods or bubbles, if some of that group have received a first dose of vaccine or fully vaccinated, what's your advice for staying safe?
Yes, I completely agree with what Brian said, and we know there's still tremendous transmission in this country. Although we've had a couple days under 100,000 reported cases, we're hovering around that 100,000 threshold. That's much higher than we saw in our spring peak. In our summer peak, we were up in 60, 70,000 cases. There's still a lot of virus transmission. And, as I said earlier, the vaccine isn't 100% effective against infection. It's not certainly not going to be 100% protective against transmission. And until we see levels go way down of cases and that we really get a handle on virus transmission in this country, people who are vaccinated still need to adhere to all the public health measures that Brian outlined. And so I don't see the vaccine right now, where we are, really altering that behavior.
Thanks, Bill. Another question for you. From the clinical trials, when we talk about vaccines and effectiveness, is that measuring total infections or severity of infections?
Yes, that's a very good question. So, in the phase 3 trials, these large randomized placebo-controlled trials that were done, and obviously for Pfizer and Moderna, and being done for other vaccines, the outcome for vaccine efficacy is any disease, mild, moderate, or severe disease. It combines those. So it's really any symptomatic disease. When we're talking about, for example, 95% vaccine efficacy for the Pfizer mRNA vaccine, or 94.1% vaccine efficacy for the Moderna mRNA vaccine, that's protection against symptomatic disease. As I said earlier, the protection is higher for severe disease. We don't yet know, particularly for those two vaccines, how much they protect against asymptomatic infection. There's some data coming out suggesting that the AstraZeneca vaccine does provide some protection against asymptomatic infection, but that's going to be lower, a lower number than the 95%.
Thanks, Bill. Brian, question for you, and Bill, you may want to jump in here as well. What do we know so far about antibodies and COVID, especially for naturally acquired disease, so not in terms of vaccination?
Yeah, so there's lots of folks that have been studying, what happens to people after they've been infected, and for people who develop antibodies, and the majority of people do develop antibodies, those antibodies have been shown to persist anywhere, depending on what study you look at, from 5 to 6 to even longer in terms of being able to detect those antibodies in the blood. But it's also important to remember that the immune system is not just antibodies, right? And it's a little bit more difficult to measure your ability of your T cells, which is an important activator of the immune system, at still having a persistent response. So there are some studies showing that even when your antibody levels start to come down, your T cells will still recognize SARS-CoV-2, and that likely would mean that you would mount a very effective immune response against it, but that's a little bit harder to study. But right now, we think that 6 months is probably where most people end up in terms of their duration of antibodies, perhaps even longer, but it's likely that immunity will last even beyond that. But it's still too early to know, right? I mean, we're only coming up on a year of having this virus widely circulating. So I think we're still anxious to understand what's going to happen. The other thing to remember is that some of these new variants have been shown to be able to evade some of those antibodies in people who have recovered from COVID-19. That does not mean that those people will necessarily be more likely to get sick, although it may, because again, we're not directly measuring some of those other immune responses that might still kick in, even if the the mutations in the virus are evading those existing antibodies. So this is still a story that we need to see how it plays out. And that's why there is concern about some of these variants and whether or not they're going to be able to lead to a resurgence in infections if we're not careful with mask wearing and social distancing until we have much better control of the spread of the virus.
Thanks, Brian. And Bill, piggyback question for you. If someone has already had COVID, should they get vaccinated? And how long do we expect vaccination to provide protection from the disease?
Yes, and I completely agree with what Brian said. And so, but there is heterogeneity. There are differences in the antibody responses after natural infection, and a suggestion that people who have asymptomatic or very mild disease, might have lower levels of antibodies than people who've had more severe disease. And it's because of this variation in the antibody response that the recommendations are that even if an individual has had confirmed COVID-19 vaccine, that they be vaccinated right now with the 2 doses of an mRNA vaccine. And that's really just to provide much more confidence that that individual is protected. There is some discussion as to whether, if someone's had a confirmed COVID-19 vaccine, whether a single dose of the vaccine, might be enough of a booster, if you will, to provide protection, but we don't have real data on that. We still, as Brian said, with natural infection, where because we're so early into this, we really don't have a good handle on the duration of protective immunity after natural infection. And the same is true after vaccination. We just haven't been able to follow people long enough to say, what the duration of protection is. And this is complicated, again, as Brian said, is by the fact that if new variants or existing or new variants emerge for which there's less protective efficacy, then people may need to get a booster dose. So I'm just guessing, but I think the protective immunity will last a couple years, if not longer. But it may be that we need a booster dose, either to boost that original immunity or because of the emergence of variants.
Thanks, Bill. Brian, I'm going to send the last question to you today. Why are we now hearing from CDC about masking and double masking? And by the way, your demo is getting rave reviews from our audience. But is it because of increased concern about variants? Like, why is this suddenly coming up so much?
Well, I think it's probably for a number of different reasons. First, I think there's a renewed emphasis on making sure that we're messaging to everyone the importance of mask wearing. And I think we're at a point now where that message is starting to get across. And so now we need to make sure that, great, if you're wearing a mask, that's awesome. But we want to make sure that you're wearing a mask that's the most effective that it can be. So I think that's one reason. And the second reason is there's concern that these variants, there's epidemiologic data from the UK suggesting that they spread more easily, the UK variant in particular. And so now is the time to try to maximize the protection that we have while we're waiting for a majority of the population to get vaccinated. So I think those are probably 2 of the most important reasons.
Got it. Thanks so much. Well, we are just at 12:30, so I'm going to wrap up. I'd like to thank Brian Garibaldi and Bill Moss for joining me today, and give a big thank you to everyone who joined us, and especially to those who submitted questions for our experts to answer. As always, this briefing will be archived and available at coronavirus.jhu.edu. As a reminder, we will offer regular 30-minute briefings on Fridays at 12 p.m. And in each briefing, we'll focus on what you need to know right now about the COVID-19 pandemic, and we will have live Q&A with our experts. I'll look forward to seeing you at our next 30-minute briefing. Until then, thanks and stay safe.